So my name is Ilana Etelzon. I'm the owner of Pain Doctors Medical. Our practice incorporates regenerative medicine, non-invasive treatments to help patients with lower back pain, neck pain, and various joint pain. I would like to introduce one of my patients for who I have done stem cells and PRP for the lower back. And he's here to tell us how it helped him.
Okay, it's helped me a lot. First of all, my injury was related with my work. I used to work as a Finnish carpenter for the 20 years, and that's hard work, and your hand is always over your head, leveling something, doing crown molding, things like that. So then I started feeling a lot of pain in the lower back, and that's why the reason that I'm disabled for that. And then I start fighting with that. So every day I wake up with the pain, and after I brush my teeth, pain is increased double, and I learned how to live with that. And to me, that's become the normal. And then, but I never give up. I always do a lot of exercise, stretching, even active in a sport. I play soccer, and then still with a lot of pain, but I never stop it. And then, let's say after the game or after practice, pain tomorrow is tremendously the increase, and then but doesn't stop me to do that. So that's mean I learned how to live with that, and I'm ready to rest to the end of my life, live like that, till Logi one day didn't tell me that we have to go and do something by Dr. Ilana. And then we are here, and after that treatment, I just, I think second day, I start feeling much better. But for me, I cannot believe, it looks like I'm in some shock. And but by home, I didn't look like happy. And my wife constantly asking me, hey, look at you, you're straight. She was with a big smile on her face. So looks she's more happy than I am because, and I tell her, she asked me, are you happy? You don't feel like, I say, I remember when I was like that 20, 30 years ago, when I walk straight. So now it's normal this again for me. And it's also, before I go to that treatment, it's normal for me to be the crooked every day. Yeah. So I accept that. And so things has changed, I feel much better, or walking straight again. And thank you, doctor, for that.
I'm glad to hear. I remember before your dad came in, you showed me the images. And after reviewing them, I did say that he has severe arthritis, but I thought the best method of treatment for you would be to include the stem cells, which of course we would acquire from your own, in addition to the PRP, and the combination to target especially the joints, that epidural space where there was severe stenosis, and all those muscles and ligaments would potentially help you. And I'm glad it did, because when you came into my office, as you said, you were all kyphotic, right? And now you're able to, as I could see, stand and sit straighter. And you look, and as per your report, you feel much more comfortable. So I'm glad to hear.
Yes.
I was away for a trip during that time. I dropped him off, or I came with him, and then I went to a trip. I came back after the weekend, and I went to the house to visit them, and I see something's different. And he looks skinnier, and something else is different physically. And then I asked my mom, does he look taller? She's like, yeah, I said the same thing, and I couldn't believe it. I mean, when I saw him in a profile view, he was straight as a pencil. Before, he was completely hunched over. And his whole life, he was slightly taller than I was. But then I realized, maybe 15 years ago when he started hunching over, he started getting shorter than me. So I just thought it was like, the cartilage in his
The
knees
bone.
and because of age. But now he's back to being
Yeah, it's a miracle.
either
Yeah,
my height or slightly
Yeah.
taller than me. I really couldn't believe it when I saw that.
it's amazing. And same goes for the knees. I know you're all your life you were working hard and you love playing soccer, and that comes with likely knee issues. We could certainly do similar for your knees if you need along the line. Did you have any fear of the treatment?
I didn't have any fear for my father. I thought because it's going to be, all pulled from his body. So I think physically he was going to be okay. But I just was skeptical financially because I never knew, I've heard about this, but I know it's fairly new. So I just had questions whether this is actually going to help or not. And if it's going to be a waste of money. But I couldn't be any happier with the results, especially after, a couple of days. He was completely pain free after 15, 20 years of being in pain. So, yeah, I'm a believer now of PRP and stem cell.
So after we did the treatment, we recommended you to undergo a treatment called shockwave. And shockwave is a therapy that helps those stem cells kind of reactivate, boost all the vascular flow so that everything that we put into the back, the joints, the epidural space starts acting faster. And especially the more of an injury that patients have, I think it's very important to incorporate treatments such as shockwave, treatments such as laser, which we now have. We have a class 4 laser, which in combination with shockwave really helps to activate those cells and gives you more of a benefit of an odds of doing better. Now we know that the treatment that we have, such as the bone marrow and the PRP, the product is very saturated in the cells to help you get there. But when we incorporate the adjuncts, the other therapies that we have, such as shockwave, such as laser, that just helps you get there so much more quicker and just have a better result. And you had a chance to try the shockwave for your lower back. How did that make you feel?
I have a couple of therapy with that, and
Still pain
Yeah,
free.
yeah,
yeah, still pain free. So
yeah. I'm glad that I think the fact that you continue to feel better. That's what we would be looking for. And if that's what you feel, then I'm happy with that treatment, with that plan.
yeah, so I hope that's gonna fasten my recovering,
Exactly.
and I think it's gonna be helpful.
It
Yeah.
just stimulates everything
Yeah.
Just
that was done.
stimulates. Yeah, yeah. It activates so much. Those same cells, especially coming from someone who may be older, right, or the injury is so much bigger. These stem cells need to be very active. Yes, we incorporate good nutrition, good sleep, combination of potential peptides that stimulate. But if we can add something as an outside source that helps to waken the body up and those same cells, that's exactly what we want, right? Because we are here to invest into our own healing.